We have so many patients coming in concerned of sagginess of their face, so they're not sure what to do. So sagginess of the face is mostly due to volume loss, majority from the mid and lower part of the face. So quick and easy way to fix that problem is by dermal fillers. Two basic questions commonly asked by many patients. What is fillers and what fillers for? Number two question is, how do I choose among this many type of fillers? What's filler and what's fillers for? Filler is FDA approved injectables to replace the volume loss due to aging. As we can see, when we're aging, most time we lose volume under eye, around the cheek area, and so we have this fall, skin fall, nasolabial fall, and a less defined jaw lines. So filler, by placing filler in this area, give you instant correction. There are really two types of fillers we commonly use in our office. As you can see, we group them together. This group is hyaluronic acid based, and the single one is calcium based. So hyaluronic acid is a major ingredient we already have in our body. So they basically function as moisturizing your skin, keep you look glow and hydrated. And this group is made of natural occurring hyaluronic acid, so they're super safe. Doesn't really need skin testing or allergy testing. They are pretty much my option of choice for my patient. My preferred hyaluronic acid fillers are this V group. As you can see, they're starting Voluma, Vollure, and Volbella. So the differences among them is number one, molecule size. So they're ranging from small, medium to large molecule size. That's depending on where you want to place those fillers and what they're for. And the number two difference of this is also the cross-link. So that sounds very technical. What's cross-link is really mean is how they connect to your protein once they inject into your skin. So the newer technology of cross-link make them last longer. So most patients just super happy about that, lasting 2 years, versus the older Juvederm only lasts 6 or 9 months. Among these three, they use for different part of the face. My favorite one is Voluma. I'm not presenting the company, so this is just based on my clinical experience and my personal opinion and the recommendation I give to my patient when they come to my practice. So Voluma is the largest molecule and it gives you most lifting effect. So it's a great filler used for anywhere, mid-face or lower part of the face. I use very commonly for under eye, cheek, and anterior of the face to give you that kind of lifting effect. It's very natural. Again, this can last up to 24 months. I don't typically use Voluma for the lips. It's just because it's super large molecule, doesn't want to give you that kind of too overfilled look. Vollure is a newer FDA approved medium size filler. So this one is pretty much you can use any part of the face. To me, I'm gradually replacing Vollure of the Juvederm because it lasts longer, like 12 months versus 6 months. And this too, again, you can place any part of the face. It doesn't give you that great lifting as Voluma, but give you that kind of expanding, so the volumizing. So it's good for anywhere, deep skin fall, give you that a little bit stretch to correcting that fall. So the last one of the Vollure Voluma family is called Volbella. So this is the smallest molecule. It's worked very beautifully for anywhere with thinner skin, such as lips, or people sometimes use for under eye area, or the smoker lines, or any other fine lines. This again can last up to 12 months. So those are my go-to fillers. Among the HA filler, I also like this Belotero. I like it because it's a unique property. It's a very fine molecule filler. I mostly use for the under eye area. When somebody come in with a deep hollowness under eye, I do the layer correction, combine this two. So deep placement of Voluma give you that lifting, and then superficially I place Belotero. The reason is it doesn't give you that kind of bluish discoloration as you can see with other fillers sometimes, such as Juvederm. So great experience with them. So this is HA family, and they do come in the syringes like this. So it's a 1 cc syringe, clear gel, and once you open it, it's just like that. One syringe can do pretty amazing work once you place in the right place. And then we're talking about the second group of filler. This is calcium-based filler. So calcium is kind of similar ingredient or component as our bone. So I like to place this one mostly in the bony area, such as, you know, cheek, when somebody have a lot of volume loss, need a lot of volume. And I also like to play in the jawline, nose, or chin to give that contour and definition. This one can last pretty long, like about 2 years. So this concludes my segment of filler part 1. If you have any questions, leave comment below and we'll answer it. And also, stay tuned for our part 2, filler do's and don'ts.